Welcome back, everyone. This is Mike. We'll continue our discussion on respiratory disorders, diagnosis, management, and prevention. The topic is pulmonary vascular diseases. We'll discuss pulmonary hypertension. Pulmonary hypertension is high blood pressure that affects the pulmonary arteries in the right side of the heart. Primary pulmonary hypertension is of unknown etiology with poor prognosis. There is absence of any heart or lung disease. Secondary pulmonary hypertension is more common and often caused by COPD. It leads to right ventricular hypertrophy. Other causes include 1. Increased pulmonary blood flow, as in congenital right-to-left shunt, like ASD, VSD, or PDA. It can also be caused by increased resistance within the pulmonary circulation from embolism or vasoconstriction due to hypoxia. And lastly, increased blood viscosity from polycythemia. In pulmonary arterial hypertension or PAH, a type of pulmonary hypertension, blood vessels in the lungs are narrowed, blocked, or destroyed. Blood flow slows and pulmonary blood pressure rises. The heart must work harder to pump blood through the lungs, eventually leading to heart failure. In some people, pulmonary hypertension slowly gets worse and can be life-threatening. Although there is no cure for some types of pulmonary hypertension, treatment can help reduce symptoms and improve quality of life. The signs and symptoms of pulmonary hypertension develop gradually. Patients may be asymptomatic for months or years. Symptoms get worse as the disease progresses. Symptoms would include 1. Dyspnea, or shortness of breath, initially while exercising and eventually while at rest. 2. Is fatigue. 3. Is syncope, dizziness or fainting spells. 4. Is chest pressure or pain. 5. Is edema in the ankle, legs, and eventually ascites. 6. Cyanosis, which are bluish discoloration of the lips and skin. And lastly, tachyarrhythmia, palpitations. What is the pathophysiology of pulmonary hypertension? The right ventricle pumps blood to the lungs through the pulmonary artery. In the lungs, the blood releases carbon dioxide and picks up oxygen. The blood normally flows easily through pulmonary artery capillaries and veins to the left ventricle. However, changes in the cells that line the pulmonary artery can cause the walls of the arteries to become stiff, swollen, and thick. These changes may slow down or block blood flow through the lungs, causing pulmonary hypertension. What are the risk factors for pulmonary hypertension? Age is an important risk factor. More often, it is diagnosed in people ages 30 to 60. Idiopathic pulmonary arterial hypertension is more common in younger adults. Other risk factors include the following. 1. Family history. 2. Being overweight. 3. Blood clotting disorders or a family history of blood clots in the lungs. 4. Exposure to asbestos. 5. Genetic disorders including congenital heart disease. 6. Living at a high altitude. 7. Use of certain weight loss drugs. 8. Use of illegal drugs such as cocaine. And lastly, use of selective serotonin reuptake inhibitors used to treat depression and anxiety. What are the complications of pulmonary hypertension? First is cor pulmonale, or right-sided heart enlargement and heart failure. In cor pulmonale, the right ventricle becomes enlarged and has to pump harder to move blood through the narrowed or blocked pulmonary arteries. At first, the heart hypertrophies to compensate and expanding the chamber of the right ventricle to increase the amount of blood it can hold. But these changes create more strain on the heart and eventually the right ventricle fails. Second is blood clots. There is an increased risk of thrombosis in the small lung arteries, which is dangerous if there are already blood vessels that are narrowed or blocked. Third is arrhythmia. They can cause arrhythmias, which can lead to palpitation, dizziness, or fainting. Certain arrhythmias can be life-threatening. Fourth is bleeding in the lungs. They can lead to life-threatening bleeding into the lungs and hemoptysis. And lastly, pregnancy complications. It can be life-threatening for a woman and her fetus. Pulmonary hypertension is classified into 5 groups depending on the cause. Group 1 is pulmonary arterial hypertension, or PAH. The causes are the following. First, unknown cause. also called idiopathic pulmonary arterial hypertension. The second is genetic mutation passed down through families, also known as heritable pulmonary arterial hypertension. Third is the use of some prescription diet drugs or illegal drugs such as methamphetamine and other drugs. Fourth are heart problems present at birth, like congenital heart disease. And lastly, other conditions such as connective tissue disorders like scleroderma, lupus, and HIV infection or chronic liver disease or cirrhosis. Next are Group 2 pulmonary hypertension caused by left-sided disease. They include mitral valve or aortic valve disease and left ventricular failure. Third is Group 3 or pulmonary hypertension caused by lung disease. They include chronic obstructive pulmonary disease or COPD, pulmonary fibrosis which causes scarring in the tissue between the lungs and air sac or interstitium, obstructive sleep apnea, and lastly, long-term exposure to high altitude in people who may be at risk of pulmonary hypertension. Group 4 pulmonary hypertension is caused by chronic blood clots, like pulmonary emboli and other clotting disorders. Group 5 pulmonary hypertension is triggered by other health conditions. They include blood disorders, including polycythemia vera and essential thrombocythemia, inflammatory disorders such as sarcoidosis and vasculitis, metabolic disorders including glycogen storage disease, kidney disease, and tumors pressing against the pulmonary arteries. Lastly, Eisenmenger syndrome and pulmonary hypertension. Eisenmenger syndrome is caused by a ventricular septal defect, or VSD. The VSD causes improper blood flow in the heart, resulting in oxygen-carrying blood or red blood mixing in with oxygen-poor blood or blue blood, then returns to the lungs instead of going to the rest of the body. This increases the pressure in the pulmonary arteries, causing pulmonary hypertension. Pulmonary hypertension is hard to diagnose early because it's not often detected in a routine physical exam. Even when the condition is more advanced, its signs and symptoms are similar to other heart and lung conditions. Most important is to take history and physical exam. Tests for pulmonary hypertension may include the following. 1. Blood tests. Blood tests can help determine the cause or look for signs of complications. Second is chest x-ray, which can show enlargement of the right ventricle or the pulmonary arteries and check for other lung pathology that can cause pulmonary hypertension. Third is an electrocardiogram or ECG, which may reveal signs of right ventricular hypertrophy or strain. Fourth is echocardiogram, which evaluates the heart and its valves. It can determine the size and thickness of the right ventricle and to measure pulmonary arterial pressure. It is also used to evaluate effectiveness of treatment. And lastly, right heart catheterization. It is used to confirm the diagnosis of pulmonary hypertension. It directly measures the pressure on the main pulmonary arteries and right ventricle of the heart. It is also used to evaluate the effect different treatments may have on pulmonary hypertension. The following test is used to check the condition of the lungs and pulmonary arteries and further determine the cause of pulmonary hypertension. First is computed tomography scan, which can show the heart's size, spot blood clots in the lungs arteries, and look closely for lung diseases that might lead to pulmonary hypertension, such as COPD or pulmonary fibrosis. CT angiography uses a dye to visualize the arteries better. Magnetic resonance imaging or MRI scan uses a magnetic field and pulses to check the right ventricular function and blood flow in the lungs arteries. Third, pulmonary function tests. This non-invasive test measures lung capacity and tidal volume using a spirometer. Fourth, polysomnogram, which measures brain activity, heart rate, blood pressure, oxygen levels, and other factors while asleep, can help diagnose obstructive sleep apnea, which can cause pulmonary hypertension. 5 is ventilation perfusion ratio or VQ ratio. In this test, a tracer is injected into a vein that shows blood flow and air to the lungs. A VQ ratio test can determine whether blood clots are causing symptoms of pulmonary hypertension. And lastly, open lung biopsy. Rarely, a doctor might recommend an open lung biopsy to check for a possible cause of pulmonary hypertension. An open lung biopsy is a type of surgery in which a small sample of tissue is removed from the lungs under general anesthesia. 5 genetics tests are also performed if there is any family history of pulmonary hypertension. How is pulmonary hypertension classified? Class 1 is asymptomatic with normal activity. Class 2 is asymptomatic at rest but symptomatic with fatigue, shortness of breath, or chest pain with normal activity. Class 3, comfortable at rest but symptomatic when physically active. Class 4, symptomatic both at rest and during physical activity. There's no cure for pulmonary hypertension, but medications can help improve symptoms and slow the progress of pulmonary hypertension. It often takes some time to find the most appropriate treatment. They are often complex and require extensive follow-up care. Primary cause or secondary pulmonary hypertension should also be treated. Now let's discuss medications. First, there's vasodilators. Epoprostenol is most commonly prescribed. They relax and open narrowed blood vessels, improving blood flow. It is administered by an intravenous pump. Potential side effects include jaw pain, nausea, diarrhea, leg cramps, and pain and infection of the IV site. Other types of vasodilators include treprostinil, which can be inhaled, injected, or taken by mouth. Their side effects associated with treprostinil include chest pain, often with headache and nausea, and breathlessness. Second are guanylate cyclase stimulators, like riociguat, which increases nitric oxide in the body, which relaxes the pulmonary arteries and lowers pressure within them. Side effects include nausea, dizziness, and fainting. They are contraindicated in pregnancy. Third are endothelin receptor antagonists. These medications reverse the effect of endothelin, a substance the walls of blood vessels that cause them to narrow. Such drugs include bosentan, macitentan, and ambrisentan. These drugs may improve energy level and symptoms. However, they can damage the liver. Therefore, monthly liver function test is mandatory. They are also contraindicated in pregnancy. Fifth are sildenafil and tadalafil. Sildenafil and tadalafil are commonly used to treat erectile dysfunctions, but they also open the blood vessel in the lungs and allow blood to flow more easily. Side effects can include an upset stomach, headache, and vision problems. Fifth are high-dose calcium channel blockers like amlodipine, diltiazem, and nifedipine. Although calcium channel blockers can be effective, only a small number of people with pulmonary hypertension improve with taking them. Sixth is warfarin, which is an anticoagulant that helps prevent blood clots in the pulmonary arteries. However, they increase the risk of bleeding, especially during surgery or an invasive procedure. Many other drugs, herbal supplements, and foods can interact with warfarin, and blood monitoring is important. 7. Digoxin. Digoxin helps the heart beat stronger and pump more blood. It can help control the heart rate in case of arrhythmia. 8 is diuretics, which help the kidneys remove excess fluid from the body, reducing cardiac workload. They also limit fluid buildup in the lungs, legs, and abdomen. And lastly, oxygen therapy. Breathing pure oxygen helps treat pulmonary hypertension, especially at high altitude or with sleep apnea. Some people may eventually need continuous oxygen therapy. What about surgery? They include 1. Atrial septostomy. In an atrial septostomy, a surgeon creates an opening between left and right atrium to relieve the pressure on the right side of the heart. Atrial septostomy can have serious complications, including arrhythmias. Second is transplantation. In some cases, a lung or heart-lung transplant might be an option, especially for younger people who have idiopathic pulmonary arterial hypertension. Major risks of any type of transplantation include rejection of the transplanted organ and serious infection. Lifelong immunosuppression is always a given. Lastly, lifestyle changes. Get plenty of rest to reduce the fatigue that might come from having pulmonary hypertension. Don't smoke. This is most important. Third, avoid pregnancy and birth control pills. Birth control pills can increase the risk of blood clots, and pulmonary hypertension can cause serious complications to both the mother and the baby. Fourth, don't travel to or live at high altitudes. High altitudes can worsen the symptoms of pulmonary hypertension. Live at an altitude below 8,000 feet or 2,438 meters. 5. Avoid situations that can excessively increase or lower blood pressure. This includes sitting in a hot tub or sauna or taking long hot baths or showers. These activities lower the blood pressure by causing vasodilation and can cause fainting or even death. Also avoid activities that cause prolonged straining, such as lifting heavy objects or weights. 6. Eat healthy and manage the weight. Aim to eat a healthy diet rich in whole grains, fruits and vegetables, lean meats, and low-fat dairy products. Avoid saturated fat, trans fat, and cholesterol, and limit salt intake. Aim to maintain a healthy weight. Lastly, get recommended vaccines like influenza and pneumonia vaccine, as these conditions can cause serious issues for people with pulmonary hypertension. Hi, this ends our discussion on pulmonary hypertension. See you next time when we discuss pulmonary edema.